Emergency room doctors tell me their 5 biggest secrets. First, round of applause. Some of the hardest working group of healthcare folks, the nurses, the docs, the PAs, the NPs, the medical assistants, the crews that keep the emergency room as clean as possible. But here are their 5 secrets. Listen carefully. Number 1, ordering consults in some centers can be difficult. A recent story is of a complex fracture that only a junior orthopedic resident saw. Out in training a couple of months, the ER doc said they had never touched such a fracture. It was so complex. And they telling me, you have to advocate for yourselves. Kindly ask an administrator and put everything in writing. Ask to see the attending consultant. Important. 2, at many centers, the staff is overwhelmed. Look, let's be honest, you can't predict when the ER is slow or packed beyond imagination with stretchers all over the place, and the nurses and doctors become exhausted. Number 3, lack of good supervision. Again, when it gets too busy, those junior staff people, the intern just out of school, the PA or NP without a lot of experience may not have adequate supervision, and the ER doctors say, if you're unsure, ask to speak to the attending emergency room doctor. 4, an example of this, a plastic surgeon comes in, stitches up your chin, and you get a bill for $10,000. For most states, don't pay it. It's called a surprise medical bill, and the surgeon's job is to negotiate that fee with your insurance. ER doctors told me they all know about it, but sometimes they'll send you the bill anyway. And number 5, many people are getting over-radiated. That CT scanner in the ER is busy, busy, busy. Chest pain, shortness of breath, abdominal pain. Not enough time to closely examine the patient or the person, the cover your ass scenario. Well, you just don't have enough experience. You don't want to miss something, and you get that CAT scan. Now, while CAT scans are extremely important, every expert will agree that there are just too many of these being done, especially in emergency rooms. And as I mentioned before, radiation exposure risks are additive. And the more radiation you get in life, the higher risk of cancer later. Recent estimates are that CT scans done in 2023 will eventually be responsible for 103,000 cancers, or 5% of all the new cancers in the U.S. I hope that helps.